Shields. I'm employed by the university, but I work also as a clinician in the Children's Hospital in Belfast. One of the big problems we face in children's medicine is a lot of children come into the A&E department with temperatures, and most of them have a simple viral infection, but a small number have a potentially serious bacterial infection. And because we don't want to miss that, many children get blood tests done. It takes 48 hours before we know the result of the blood test, so the doctors therefore treat the children immediately with powerful intravenous antibiotics just in case. But the vast majority don't have a serious bacterial infection. So what we have been trying to do is devise a point of care test where we can diagnose if there's a serious bacterial infection in the first 15-30 minutes of a child coming to the A&E department. And that's what this test is. The first bacteria we looked at was what's called the meningococcus, which people probably know as the very rapid onset disease of children that cause a fever, a rash, and children can be dead within 24 hours of the start of the illness. So you can see why doctors want to be safe rather than sorry. But we would like to be able to diagnose it early and to be sure of the diagnosis, and therefore the children who don't need antibiotics could possibly be sent home without them. And it's important not to be using antibiotics when you don't need to. The device, which was developed at the Belfast Trust in the Royal, and we've done the clinical tests here jointly with the university and the trust, is now an easy point of care test that a nurse or a doctor without any laboratory training can do, and can usually have the result within 15 to 20 minutes. The company was set up, Hybergene, which is based in Dublin but has now a Northern Ireland office, and they've actually commercially produced the equipment, so you can actually buy the test kit and be able to do it, put it into practice. And we're starting to see it being put into practice around the UK and around the world, in fact. In Northern Ireland and in the UK, clearly we overtreat children and we're trying to reduce inappropriate antibiotics. But if you went to a third world country such as Malawi, they don't have laboratories that can diagnose illnesses, and often the children, they're just treated for malaria, whereas they have the same conditions, bacterial conditions that our children have, like meningococcal disease, and often they're not treated and they can easily die. And we think that this would be a very, very good solution. The Maclay Foundation have actually provided us with some research funding to try and develop the tests so that they can be used in situations like Malawi, and this is very important, I think. In the future, we've developed the test so that not just meningococcal disease, but we can now detect Group B streptococcus, and Group B streptococcus is the common cause one of the common causes of neonatal newborn meningitis. And we hope that with doing this test during labour, we'll be able to tell which mothers are carriers of the Group B strep and who need treatment, and which babies need treatment, and which mothers aren't carriers and who don't need treatment. So that's where we're going in the immediate future, where we're planning to go.